I'm a naturopathic doctor with 20 years of gut health experience, and I'm going to show you something most doctors won't. Exactly what I eat. Not a perfect clean diet, because good gut health isn't about perfection. It comes down to understanding one principle that most people skip entirely. And once you get it, the confusion around what to eat basically disappears. If that sounds like a relief, hit that like button. Let's get into it. Here it is. With Hashimoto's, what you eat matters, but what you're trying to do with food matters even more. Most people with Hashimoto's are approaching food like it's performance. They're eliminating gluten, dairy, nightshades, and they're eliminating joy, and they still feel exhausted and inflamed. And I get it. My patient Diane came to me with a 4-page list of foods she had already cut out. She was surviving on plain chicken and rice and a lot of anxiety. Her antibodies were still climbing. Her energy was still gone. Here's what Diane was missing. The goal of food with Hashimoto's isn't to find the perfect elimination list. The goal is to eat in a way that consistently calms the immune activation and lowers inflammation. Those are different targets, and once you aim at the right one, the whole approach shifts. Your immune system responds to patterns over time, not to a single perfect meal. Consistency beats perfection every time. So what does my actual routine look like? And yes, I have Hashimoto's, so this is personal. Let me tell you about the strangest conversation I have on repeat with my Hashimoto's patients. They come in with their food journals, their elimination lists, their carefully researched supplement protocols, and one of the first questions I ask them is, when did you last go outside before 9 a.m. without your sunglasses on? Dead silence. Every time. Here's what most people don't realize. Your immune system doesn't just respond to what you eat, it responds to light. Specifically, though, the timing of it. Your body runs on a 24-hour internal clock, your circadian rhythm, and your immune system is synced to that. The natural light you get in the first hour or two of the morning is what sets that clock for the day. It triggers a cortisol pulse that is actually supposed to happen. A healthy morning cortisol rise that tells your immune system when to be active, when to stand down, and how to regulate itself throughout the rest of the day. When that signal is missing because you're waking up in a dark room, going straight to your phone, driving to work with sunglasses on, sitting under fluorescent lights all morning, your immune clock drifts. And for someone with Hashimoto's, a dysregulated immune clock means more inflammation, more erratic antibody activity, and that relentless fatigue that no amount of sleep can fix. So, before we even talk about food, I tell my patients, get outside within 30 minutes of waking up. No sunglasses, even on a cloudy day. Cloud-filtered light still carries enough signal, even in the winter. 10 to 12 minutes is enough to move the needle. It costs nothing. It requires no meal prep. And in 20 years of practice, it's one of the most consistently underestimated things I have ever added to a Hashimoto's protocol. That same patient, Diane, one of the first things we added wasn't a new elimination. It was a 10 to 12 minute morning walk outside every day. She then told me 3 weeks into that, her sleep had shifted, her afternoon energy crashes were less severe, and she felt for the first time in a long time like her body had some kind of rhythm again. That's not a coincidence. That's circadian biology doing its job. Beyond the morning walk, here's what consistently lands on my plate. Anti-inflammatory fats at every meal. Olive oil, avocado, fatty fish. Not because I'm following a trend, because omegas directly reduce the inflammatory signals that drive Hashimoto's activity. Cooked veggies over raw, especially cruciferous veggies like broccoli and cauliflower, which I always cook because raw cruciferous veggies can interfere with thyroid hormone production in some people. Selenium-rich foods a few times a week like Brazil nuts, sardines, eggs, because selenium is the nutrient the thyroid uses to defend itself from oxidative damage. And bone broth or collagen-rich foods regularly, because gut integrity is foundational to everything else in autoimmunity. What's not on my plate? Gluten, most of the time. Not because gluten is evil for everyone, but because the molecular structure of gliadin, the protein in gluten, is similar enough to thyroid tissue that in some people with Hashimoto's, it can trigger a cross-reactive immune response. So I eat it occasionally. I pay attention to how I feel. That's the actual practice. No spreadsheet, no 4-page elimination list, just consistent intentional choices that lower the inflammatory load over time. And if you want help figuring out what your specific Hashimoto's diet should actually look like based on your labs, your symptoms, and your life, check the description and the pinned comment below. Now, here's the part that surprises people the most. Some of the foods with the biggest health trends are the ones I see cause the most problems in my Hashimoto's patients. And that's things like raw kale or even raw kale smoothies, high-dose iodine supplements, soy, even the organic non-GMO kind, and kombucha by the bottle. These can all be genuinely problematic depending on what's happening in your immune system and in your gut. My patient Teresa, who had been drinking a daily green smoothie with raw kale, spinach, and a scoop of spirulina for 6 months because she read it was good for her thyroid, well, her TPO antibodies had climbed 200 points in that same window. The smoothie wasn't bad, but the raw goitrogens and high-dose iodine were exactly the wrong inputs for where her thyroid was at that moment. If you've ever tried to eat healthier with Hashimoto's and somehow felt worse, you're not broken. You may just be eating for the wrong target. And that's something we can fix. The bottom line is, eating well with Hashimoto's isn't about finding a perfect diet. It's about consistently eating in a way that calms your immune system, supports your gut, and gives your thyroid what it actually needs to function. If you do that regularly, your body will start to show you the difference. If you want to go deeper on the root causes that are driving your Hashimoto's in the first place, I made a video on that next.